So the things that you're responsible for within the department are all the different types of work-based assessments. So the training activities, there's a huge list on the curriculum that describes what the trainee is expected to be learning as they go along to get to those learning outcomes at the end of it. So there's a number of different training activities. In the past, the STP, we used to call these competencies, but we now call them training activities because that describes them better. It's not really a competency, it's a training activity. There's also some different types of work-based assessment. So there's the DOPS, which are the direct observed practical skills, OCs, which are observed communication events, and case-based discussions, or CBDs. Next slide, please. You might need to click again, Sally. So the training activities are divided into three different types. And this is a change that we've made since we had the curriculum review. And it helps to describe what's expected of the trainee by the end of the programme in these different areas, and also what kind of evidence is required to show that they've met these. So the first one is an observational training activity. And this is something that your trainee might do so that they become aware of something, but they're not really expected to be competent in it. So an observational training activity might be something like observing a valve clinic or observing a procedure in the cath lab. So they don't need to be competent and able to do that on a day-to-day basis, but they need to understand what happens there, how it fits with their role, and what place it has in the patient journey. So for an observational training activity, the evidence requirement will be things like evidence that they've done this task, but more importantly, reflections before and after. So they reflect on what they expect to gain, expect to see when they go to this activity, and then they reflect on what actually they learned from it and what they took from it. So it helps to show how they're developing and understanding the wider picture of cardiology. We also have developmental training activities and entrustable training activities. Entrustable training activities are things that you want your trainee to be able to do over and over again with minimal supervision by the end of the programme. So it might be something like getting the images for a parasternal long axis view. So you would expect your trainee to be able to do that with minimal support from you by the end of the training programme. A developmental training activity is something they're going to do less often, so they don't need to be able to do it on their own, but they really need to have seen it and had a go at it so that they understand the difficulty of it. And the evidence base for those is slightly different. And the way we categorise these was chosen by our curriculum review team. So it was colleagues within the workplace who felt that this was the level trainees should be getting to by the end of it. If you go on to the next slide, please, Sally. So the training activities are something that trainees do over time. It's not just one thing that they do. It might, for the observational ones, it might be one time they saw it, but they will need to reflect before and after. So the evidence is gathered over time to demonstrate that they are learning along this this journey. They upload this onto the OneFile system, and it's all very straightforward how to do that, and there are webinars that teach the trainees how to do it. Training activities do take time. They don't necessarily expect to be signed off first time. So when they do a training activity and they hand it in, it will go to you for assessment and feedback. So you'll have a look at what they've done on that training activity, and you'll give some feedback. And if you want more reflection, or if you think they've misunderstood something, then you give them feedback, and they'll update that training activity. And eventually, when you're happy with it, you can sign it off. What is accepted and who can sign off is down to you as the training officer. So you don't have to sign off every single training activity. It might be that you delegate that responsibility to somebody else in the department who has the time and the competency to do that. So we don't say that training activities have to be signed off by a certain level of person. What we do say is that they need to know what they're doing within that task. So for things like certainly on our STP, things are like doing an 12 lead ECG. That doesn't necessarily need to be you. It can be anybody in your department who does that as their activity and does it well. You can ask them to sign it off, but you'll need to give them some coaching maybe in how to do some feedback. The trainee will discuss with you who should sign off which activity, where it's not going to be you. They will then nominate that person on OneFile, and you will get a request from OneFile asking to agree with that. So the trainee can't just get their mates to sign it off. You know, it does need to be the correct person doing it, but you discuss that with your trainee. The level that's acceptable of it, we've tried to give as much information in the curriculum library about those different types of activities so that you can follow that and you can make sure that all the trainees are doing it to the same standard. But remembering that this is a postgraduate level course, so the standard that we expect of our training activities is at level 7. It's the same as the STP. And the whole OneFile should demonstrate the trainee's journey to mastery and proficiency of the task over time. So particularly for those entrustable training activities, they're not doing it just once. It should be something that they are competent to do, that they've done a few times, that you're happy that they're doing it correctly on their own with little support from yourself. And the assessor should review and provide feedback so that the trainee's developing, they're progressing all the time. Next slide, please. So this is a snapshot taken from our curriculum library to show you what it is. So on the left, we have 20, 21, 22. That's just the number of the training activity. The numbers next to it refer to the learning outcomes that it is providing evidence for. So there's a list on the website of the learning outcomes for each module, and they are all directly related to the training activities that we're asking of trainees. So you can see that the first one there is acquire and optimize pulsed and continuous wave Doppler tracers and make measurements in accordance with the local and BSE protocol, including use of a standalone CW probe. So the activities in there are mostly based around the BSE syllabus. So we're not asking you to duplicate all the training that you're doing. It does align. The academic work, the OneFile and the BSE are all working towards the same eventual outcome. They're teaching the trainees all the things they need to know to be competent echocardiographers. In this case, it's an entrustable training activity because you want them to be able to do that on their own every time they do an echo. If you click on view at the end of it, it'll take you to another section that gives you more information about this. So you can have a look at all the different activities they need to do, and they're very much part of the job, most of them. There'll be a few in there that will make them think a little bit outside the box. So there's things like looking at technology and giving a presentation to the department. So that's a little bit beyond what's in the BSE curriculum, but it's developing them into really good healthcare scientists. Next slide, please. So if you press that view button, you come to this page here, which gives you all the information about it. So it tells you what the type of training activity is. This one, it's an entrustable training activity, and it tells you what the evidence requirements are. So it specifies exactly what they need to be doing. So you're not going to sign somebody off an ETA the first time they use the continuous wave probe. You want to know that they're going to use it all the time on patients. And at the bottom of it here, we have considerations. And this isn't something that they have to tick every single box for, but the things that they need to think about when they're learning. So things like patient capacity is how well the patient understands what they're saying to them. It's about communication, those skills that they need. You might have different things for inpatients, outpatients, so you might need to think about how you do things differently for people, adapting behaviours and practice for the needs of the individual. So it's all about the things that they should be considering when looking at their training activity. Next slide, please. So the assessments are a little bit different. They're a bit more formalised into times that you will observe your trainee doing something. So the direct observed practical skills, it's about you watching your trainee perform a routine practical task to make sure they're doing it correctly, basically. So the trainee will undertake some sort of a practical activity in the workplace. You will observe them and you make a judgment on whether they're doing it correctly. You will give them some feedback that might help them to improve it for the next time. But it's looking at the skills, behaviours and attitudes to make sure that you're happy they're doing it correctly. Next slide, please. So in the syllabus, in the curriculum, there are some different types of DOPS or OCs, and you don't have to do all of them. You need to do a number of them and that you choose from there. So things like preparing a patient for and performing a 12-lead ECG, preparing a patient for an echo, including the checking ID, blood pressure, height and weight. So they're not complicated tasks, but it's to make sure that you can be happy that the trainee is doing it correctly. Next slide, please. Observed communication events are where you can observe their ability to communicate with the trainee, with the patients. It also doesn't necessarily need to be your patient. You can do some of these OCs with other members of the department to be able to see what their communication skills are and make sure that if they're struggling with that, you can give them some extra feedback to help them to improve that. So in each of the OCs, a trainee will engage in an interaction with another person, and you as an assessor will observe their interaction, make a judgment on how well they did it, and give them some feedback to help them improve going forward. Next slide, please. So again, we have a number of different OCs, and you'll pick from those which ones you're going to assess your trainee on. Next slide, please. Case-based discussions are a little bit different to that. This is a way of you understanding that trainees understand a full case or a part of a case. So they're not just thinking of a task, they're thinking about problem solving and decision making within a case. So you will ask trainees to come to you, and it's usually something like the trainee's done an echo on somebody and they had something on it that was really interesting. So they'll come to you and they'll talk to you about what the referral was, what they found on the echo, how they talked to the patient, what happened to the patient afterwards, did they go on to be referred for surgery, or all those kind of things. And it's about you talking to them and making sure they understand how the echo fitted into that larger picture. So they can come with all sorts of, most of them will do it with a PowerPoint presentation and talk you through it, but there's lots of different ways to do it, and it's really you checking that they're thinking and synthesizing all those different bits of information with their behaviours and their clinical judgment as they go along. Next slide, please. So this is a slide to show you our work-based assessment standards. And again, when we did the curriculum review, we knew that people wanted a lot more information about these things. So we've tried to put as much information in there to try and explain all the different types of training activities, what the evidence is needed, why we are asking for them, and all those kind of things in there. So there's a whole section there that you can have a look through. They're all short sections within it. There looks to be a lot there, but they're quite short sections. And it explains what I've been trying to say a lot better than I have done.